Welcome to my video. My name is Martin Rose. I will answer the question given by my lecture.
Case Study 12 Forced treatment of the mentally ill Mr. Mr. Ms. FZ and Ms. FG had been involuntarily committed to a psychiatric center. Each was being retained pursuant to orders from the local county court, which had found them being persons in need of involuntary care and treatment, in that they had a mental illness for which care and treatment as a patient in a hospital is essential to their welfare and judgment are so impaired that they are unable to depend on the need for such care and treatment. These patients refused to be medicated with antipsychotic drugs. Their objections were overruled, and they were subsequently medicated with various antipsychotic drugs. Mr. Mr. and Ms. FZ thereafter commenced a declaratory judgment action against the commissioner and officials of the psychiatric center. They sought to obtain an injunction against the non-consensual administration of antipsychotic drugs and the declaration of their common law and constitutional right to refuse medication. Ms. FG refused treatment with antipsychotic drugs, but was thereafter forcibly medicated. She alleged that the forcible use of antipsychotic medication violated her common law and constitutional right to determine her own course of treatment. Yes, every individual of adult years and sound mind has the right to delineate the course of his medical treatment. This fundamental right is coextensive to mentally ill patients. The fact that the patient's facilities are mentally ill or have been involuntarily committed does not constitute a sufficient basis that you lack the mental capacity to comprehend the consequences of their decision to refuse medication and to understand that their refusal poses a significant risk to their physical well-being. No, the right to reject treatment refers to patients of sound mind. The above-mentioned patients seem to be impaired and to lack the capacity to make a reasoned decision with respect to the proposed treatment. Therefore, these patients can determine the course of the treatment, and they should be treated with antipsychotic drugs for their best interests. Notes about the case study court decision. This case came before the Court of Appeals of the country after the trial court had dismissed the patient's complaints, mainly their right to refuse medication. In addition, the trial court determined that these patients were so impaired by their mental illness that they were unable to make a competent choice in respect to their treatment. The lower court affirmed the dismissal, and the appellants appealed. The Court of Appeal reversed the ruling, stating that the individual must have a final say in respect to decisions regarding his medical treatment to ensure that the greatest possible proliferation be accorded with his autonomy and freedom from unwanted interference with the furtherance of his own desires. This right extends equally to mentally ill persons, who are not treated as persons have lesser status or dignity because of their illness. The court stated that the fact that patients were mentally and were involuntarily committed did not constitute a difficult basis to include those who did not have the mental capacity to comprehend their decision. The court rejected any argument that the fact that appellants are mentally ill reduces in any manner their fundamental liberty to reject antipsychotic medication. The court reversed the dismissal of the patient's action and remitted the case to the trial court. Discussion. Forced treatment of mentally ill patients. Respecting a person's dignity. Committee to respecting his choices. Be mentally disabled does zero preclude the right to choose and to be respected. A person's dignity is not embodied in his ability to choose, but rather exemplifies his existence as a human being. That being the case, it is not a question of respecting a person's choices and as a sequence respecting him, but rather respecting him as a human being, and as a consequence respecting his choices. Thus, mentally disabled people have the same degree of dignity as any other human being and their choices should be respected. For example, they have the right to refuse treatment. Every patient's decision must be examined in the light of the specific circumstances. A patient who chooses to be hospitalized is automatically considered to be a person who agrees to every treatment. Denying their rights on the grounds that they are incapable of making meaningful decisions can also serve as an excuse for forced treatment. Furthermore, informed consent is a basic right that is based on the recognition of the patient's human status as a free man and on society's obligation to respect his dignity. Refusing treatment is part of the patient's expression of autonomy and dignity. In our case, there is no mention of whether the appellants have a guardian. If they do, the guardian, who must act in their best interest, should consider whether or not to consent to the treatment. If they do have a guardian, then they're probably some competent and capable of making their own decisions, which we, in turn, must respect. Prelection of individuals who are unable to give their complete condition must be stronger and executed with as much caution as possible, so as not to take advantage of their impairment or to advance goals which are not worthy, as stated in Article 8 of the Universal Declaration on Human Rights. In applying and advancing scientific knowledge, medical practice, and associated technologies, human vulnerability should be taken into account. Individuals and groups of special vulnerabilities should be protected and the personal integrity of such individuals respected. It is important to stress that the obligation of the medical staff is intensified, owing to the impaired state of the psychiatric patient, but as long as he is not a danger to society, his desire to refuse treatment must be considered as an option. The staff in charge is bound to act in the patient's best interest and in a manner which benefits the patient. However, the benefits should be considered along with the patient's personal choice in view of the situation.
The question is, should the hospital allow mentally ill patients to determine their own course of treatment? My answer is yes, because every individual of adult years and sound mind and has the right to determine the course of this medical treatment. This fundamental right is constitutive to mentally ill patients. The fact the patient at a state facility are mentally ill or have been involuntarily committed does not constitute a sufficient basis to conclude that they lack the mental capacity to comprehend the consequence of their decision to refuse medication and to understand that their refusal poses a significant risk to their physical